you ever thought about how generalized medicine is becoming? Thanks to the internet, checkups, prescriptions, and even therapy can be conducted from your bedroom, or your car, or the beach, I guess, if you wanted to. It's not hard to imagine a near future where, with a single click on Amazon, you can get a same-day appointment to go over the results of an X-ray that you took with the portable X-ray machine that they delivered to your house on Black Friday. I mean, imagine that. The big, gray, driverless truck pulling up to your doorstep to drop off the latest medical tool or prescription medicine. If you told this to someone 30 years ago, they'd probably scoff at you and then tell you to get a job because the internet is never going to take off. Thanks, Mom. But if you told this to someone 300 years ago, they may give you a more surprising answer.
No, our 1600s friend might not know what overnight shipping is, but they would understand a one-stop shop for all things medicinal. Amazon, they might say. Is that the name of your local barber? Christopher Amazonian? No, you fool, he'd reply incredulous. It's the service that gives me medicine. That's what I said, the confused time traveler replies. Well, futuristic to us now, the ancestor would have been all too familiar with the concept. In fact, they may be on their way to a barber surgeon as we speak. These human Swiss Army knives, almost literally, combined all things surgical, from dentistry to actual surgery to your basic fade. They were the ones you'd go to for any operation. That might seem odd at first, but is it really stranger than clicking a link on a massive website selling everything from books to plungers to these things, and having a flu shot delivered to your door? More than many other features of our lives, I think we often believe medically, and scientifically we are light years beyond the past, that if nothing else, the way we approach medicine is to our ancestors what their societies were to apes. But if we dig up some of medicine's history, we see that things aren't as distant as they seem, not only in terms of knowledge, but in how we approach medicine as a society. I mean, we have this man in charge of America's National Health Service. Regardless of your opinion of him or his opinions, I think it is uncontroversial to say there is currently a growing mistrust of the medical field and its specialists. And whether that distrust is warranted or not, and I don't think it really is in most cases, is a separate issue. What is significant for us is the fact that, like the alchemists and chemists and biologists of earlier times, suspicion around medicine is prevalent. We even have celebrities like Gwenyth Paltrow forming companies that promise to make us healthy, that take us back to a time when humans weren't filled with chemicals and were more in touch with nature. But what does this mean? Are we not healthier than our ancestors? Did they possess some secret that we no longer have about how to enjoy a healthy lifestyle? All of this, I think, brings us to a bigger question. How did we get here? What was the birth of the modern doctor? And how modern is that birth, really?
Inter Prismatica.
Lee had been suffering from stomach pains for a few days. They started out bearable, but now they were interfering with his work. He knew something was wrong, and he needed something to be done. There had been a nasty bug going around recently, and Lee didn't want to end up bedridden for days because of it. Lee knew the risk, though. There was no cure yet for the dastardly virus. But the doctor reassured him. There was a new experimental drug that was being developed, something that promised to cure anyone infected. A hopeful, or perhaps desperate, Lee agreed. He would take the experimental drug. At this point, many of us would pause, and perhaps for good reason. After all, it could be nothing at all, just some indigestion, or maybe a harmless case of bad eggs. Would you take the drug? Luckily, we know what happened to Lee. He was fine. The drug did its job, and he recovered in no time. By the next day, he was back to work at the palace of Emperor Huangdi, copying manuscripts by candlelight. Yeah, you heard that right. Copying, by hand, by candlelight. You see, Emperor Huangdi reigned from 2698 BC to 2657, and this story happened sometime during the early years of his reign. Yet, this story could have happened yesterday, couldn't it? Though we have medicines and treatments unheard of 1,000 years ago, diseases and the desire to cure them have existed since society first fell sick. That little thought experiment does a little work for our argument, though. It's meant to unsettle a tidy story we tell ourselves about medicine, that modern medicine is a clean, linear march forward, a story of ever better tools, from microscopes to antibiotics, pushing us away from the mystery of the past. It hints at a different story. Medicine changes not only by invention, but by ways of seeing, by forms of attention that are taught, institutionalized, and defended.
This is where we enter a strange irony. All of the people saying we need to discount modern medicine, that it's harming us, that we need to go back to what our primitive ancestors were doing because they had a better grasp of nature, are ignoring the fact that our current medical knowledge exists because of the advancements that our ancestors made. To discount modern medicine is to discount all of the societies that contributed to our current medical canon. In a way, by saying that we need to go back to what our ancestors were doing, you're ignoring the fact that they led to what we have today.
So let's begin there, not with a claim that everything ancient was as good as or better than our present therapies, or that we need to revert to our ancestors' ways of living. I think we would be premature to say that, but with a recognition. Many ancient cultures developed complex, systematic medical practices. They kept records, trained practitioners, built therapeutic repertoires, and argued about evidence. They weren't improvising, they were practicing medicine. Take, for instance, our old friend Otzi. Unfortunately, he wasn't available to talk with us today, something about a BPS lesson at the local fishery. But we do have a timescape we can visit, 3300 BC. The Sahara is getting drier, a face is sculpted in Uruk, Sumeria, modern-day Iraq, and cattle is to be found more common in the Nile as the Egyptians continue to domesticate the beasts of burden. We know Otzi suffered from painful joint conditions, and his autopsy revealed he suffered from a parasite known as whipworm. In the months before his death, it is also clear he suffered from a litany of other issues, as indicated by indents on his fingernails, called Bowes lines. But it's those joint issues I want to focus on. If you remember from our first, and hopefully only conversation with the obnoxious Iceman, he had a little over 60 tattoos, almost all of them around ailed areas. I was intrigued by this. What could they mean? Were they there to mark treatment areas? Were those treatments themselves? Were they related to medicine at all? I mean, what about the fact that tattoos were found on Otzi's chest, an area where, as far as the autopsy could find, there were no ailments? But let's do a perspective shift. What if we're completely wrong? Someone could easily argue that simply because we consider these practices, like acupuncture, to be medical practices today, doesn't mean they were considered that all these thousands of years ago. What if we're applying our own traditions and modalities to those of the past? What if, for Otzi, the tattoos, even if we consider them acupuncture, weren't considered medical at all? What if, for example, drawing on his body was an attempt to communicate with the spirit realm? What if the actual tattoos weren't important, but the act of drawing them was, like a sacred ritual used to invoke the gods? After all, the relationship between spiritual and physical healing is long attested. Think of hands smoked in a cauldron, or substances poisonous when consumed but medicinal when inhaled in vapor form over heated stones. Today, very few people would consider prayer to be a medical procedure. Most doctors wouldn't prescribe prayer to someone with the flu. But what if in Otzi's time, things were the reverse? What if prayer, just as a random example, was considered a medical practice, and acupuncture, something with medical associations today, was actually for them considered spiritual, or even symbolic? What if we're looking at all of this with modern lenses and failing to see how things we view one way today may have been seen differently then? But would any of that have made them less intelligent or even bad doctors because what they considered medicine was different from what we consider medicine? And should we even care if they viewed medicine in different terms? After all, the problems they faced were the same we face today in many ways, and just like us, they were simply trying to figure out solutions to those problems. Maybe it's okay for us to view Otzi's tattoos as medicine even if he didn't, because it helps us, according to our current epistemology, to better understand what they meant. And judging by Otzi's ailments, life was certainly filled with challenges. But we don't need to rely just on Otzi for insight into ancient medicine. Other practices and beliefs were and had been emerging in other parts of the world, like Asia and Africa. As Egypt was developing into a miraculous dynasty, so too was their medical practice. I mean, in the 4th millennium BC, we have evidence that Egyptians viewed serious disease as a punishment. And sure, you might look at this and think, well, there you go, the Egyptians were backwards in how they viewed medicine. But is this really all that different from the way certain people view it today? I mean, there are plenty of people in modern times who would look at a sickness as divine punishment or some type of retribution from divinity. How many people avoid going to the doctor because they think that they can spiritually heal themselves and that the affliction just needs more prayer? And that's not to criticize that way of looking at medicine, it's simply to point out that just because an ancient culture looked at something one way doesn't mean we've completely gotten rid of it. If we move forward in time to the 2nd millennium BC, we see that Egyptians were actually specializing in certain medical practices, the way that we do today. Driving down the highway, you'll see a medical facility that's dedicated to eye care, and another that's dedicated to lung research, maybe another one that's dedicated to how Tic Tacs influence the way that you sleep at night. Well, these were things that Egyptians were doing way back in the 2nd millennium. They had specialized doctors for dentistry, for eye care, for surgery. In fact, when Herodotus wrote his histories, he notes the high level of specialized Egyptian doctors. It's also interesting to note that the first Egyptian doctors were housed in per-ankh, or houses of healing. And this gives a strange resemblance to the way that we treat doctors today. Not necessarily a bad thing, but just the fact that doctors are sort of cordoned off into hospitals or healthy areas that we have to go to in order to get medical practice. And sure, there are still doctors who do house calls, but the majority of them, I think it's safe to say, practice their medicine in a sterile environment that's sort of cordoned off from the rest of society. In the 17th century BC, we have the development of the Edwin Smith Papyrus, a remarkable document that shows early trauma research, and perhaps you've heard of the name Imhotep, probably Egypt's most successful doctor. He's the one who actually extracts medicine from pure spirituality and starts to recognize medicine as a physical practice with physical causes and physical effects. Or take India's surgical tradition, the Sushruta Samhita. A surgical compendium attributed to the figure Sushruta gives remarkably detailed descriptions of procedures, instruments, and even reconstructive techniques. Or China's medical text that we mentioned earlier, the Huangdi Neijing, which organizes diagnostic methods, pulse theory, and an entire theory of how the body's equilibrium is maintained. In 440 BCE, we see Hippocrates beginning his career and developing the Hippocratic Oath, something that modern students and doctors still use to pledge their allegiance to the care of their patients. Moving forward to 70 CE, we have the development of
De Materia Medica by Pedanius Dioscorides,
which lists out herbal medications and influences modern pharmacology. In the 2nd century CE, Chinese doctor Hua Tuo pioneers a new type of anesthetic, paving the way for further anesthesiology research. And then in 162, we get Galen, moving to Rome, developing his theory of the 4 humors, but also emphasizing first-hand observation, experimentation, and anatomical knowledge. One of Galen's prevailing contributions was his combination of opposing approaches to medicine. In Galen's time, medicine was largely divided into 2 camps. The empiricists, who believed that experience and observation were the most important things in curing a human being, and the dogmatists, who believed that knowing the causes of diseases was more important in developing a cure. Galen decides that both of these have valid points and should probably be combined into some synthesis of how we practice medicine. And of course, no genealogy of medicine would be complete without mentioning Paracelsus, one of the most controversial and interesting figures in medical and scientific history. Paracelsus, who was an alchemist and a chemist, rejected the dogma of his time and becomes a prefigure in germ theory by describing illnesses as something that invades the body. His synthesis of chemicals and a belief in pharmaceuticals influences the development of pharmacology, and his method of researching, testing, and formulating drugs still supports modern drug development. It was through Paracelsus that we get the adage, "the dose makes the poison," that something in large amounts might be fatal, but in smaller amounts might be enough to cure whatever disease is afflicting you.
Why does all this matter?
Well, because what we call medicine, the practice of diagnosing, treating, teaching, requires more than a few lucky remedies. It requires vocabularies, classificatory schemes, training methods, and institutions to reproduce the knowledge across generations. Ancient systems had all of these.
One of the strangest biases in popular histories of medicine is how readily we place innovation in the West and antiquity in the East. And whenever I hear that phrase, Western medicine, I immediately have to pause and ask, what exactly do we mean by that? Where are we drawing the line that separates West from East? Are we drawing it at Greece? Because Greece is technically a Mediterranean country and had way more interaction with Persia and Egypt and Macedonia than it did England or France. And where do we begin the timeline of Western medicine? Do we start with Galen? Well, that sort of discounts Hippocrates and his contributions. And yet, if we start with Hippocrates, well, that discounts the doctors that came before him and the doctors practicing at the same time, but in different areas. Seeing medicine as a Western evolution is an easy story. Europe modernizes while tradition lingers elsewhere. But the reality is a little more complex. A lot of the practices that we associate with the birth of clinical medicine, like pulse observation, note-taking, record-keeping, these had their origins in Indian and Asian context, often centuries earlier. Take Galen's theory of the four humors, for example. The idea that the body is governed by four discrete substances, and when one of these substances is out of balance, the body becomes sick. We can actually find this idea back in the Indian Ayurvedic tradition, centuries before Galen. And yes, the Ayurvedic conception of the humors is not the same as Galen's. They only had three substances, and the substances were different than the ones Galen described. But the idea of discrete substances governing the way the body operates was not something that the West discovered.
And let's not forget that much of the development of Western medicine owes itself to these other cultures. The reason Galen became the dominant medical figure in post-medieval Europe is because Islamic scholars during the Abbasid Caliphate collected and translated his and others' works. And they didn't just translate, they also created. For centuries after his death, a text by the philosopher and physician Ibn Sina, known as Avicenna in Europe, was required reading in European medical institutes because of its profundity and importance. In 1242,
Ibn an-Nafis,
discovers pulmonary circulation,
Ar-Razi,
noted the link between mental and physical health, and prescribed remedies to mental disorders that modern medicine is only now rediscovering, like music therapy. To assume that the West simply pulled new medical knowledge out of the cemeteries of the most recently deceased ignores the staggering contributions that other cultures had in preserving and distributing medical knowledge. And look, convergent practices don't mean identical theories. I know. Chinese diagnostic categories, Ayurvedic conceptions of the humors, and Galenic anatomy each framed the body differently. But they share a commitment to systematic observation and to transmissible methods. And through trade, translation, and conquest, through the Arabic-speaking medical schools of the medieval period, the Silk Road networks, the movement of manuscripts, ideas traveled and recombined. Medicine is global in its history, even when the popular narrative pretends otherwise. At the same time, though, it is important to remember that medicine hasn't become what it is today simply because we've advanced through small steps over years. It helps to think in terms not just of techniques and tools, but of epistemology, a way of seeing, classifying, and validating knowledge, because medicine is, in part, a taught way of looking. I mean, look at Galen, for example. His synthesis became a medical orthodoxy for centuries because it was taught in the schools, copied in commentaries, and institutionalized in curricula. That pedagogical power sustained his framework long after empirical anomalies had accumulated. If a surgeon noticed that something didn't quite match what Galen had described, the response wasn't, "I wonder if Galen was wrong." The response was, "I must have done something wrong," or "This must just be a one-off, it won't happen again." It's not until Vesalius upends Galen's theories that we start to see more development in the medical literature, where we start to see more testing, more research into what causes diseases. But even Vesalius is not immune to the dogmatism that arose in the wake of Galen. When people tried to contradict Vesalius, he would rebuke them. People like Gabriele Falloppio, who may have contributed more to medicine if not for Vesalius's rebuke. The lesson here is simple, albeit uncomfortable. Medical truth is not exercised in a vacuum. It's produced by teachers who command audiences, by instruments that extend the senses, and by institutions, hospitals, medical faculties, licensing bodies that stabilize certain methods as authoritative. Later, with Laennec and Bichat and others, new instruments and new anatomico-clinical correspondences reshaped the field. The stethoscope turned interior sounds into observable signs. Tissue pathology reframed disease as localized lesions. These were deep advances, but they also created a new regime of attention. What counts as evidence narrowed toward what could be seen, touched, or classified within the clinic.
This is where French philosopher Michel Foucault provides invaluable insight. In 1963, he publishes a foundational book on the history of medicine called Birth of the Clinic. In it, he argues that the ways we practice medicine are not just the result of linear evolution, but changes in epistemologies, ways of seeing and knowing the world. He specifically brings attention to something he calls the clinical gaze, the way that clinicians interact with and regard their patients. For him, the clinical gaze is both promise and power. On the one hand, when clinicians learn to see the world in new ways, they cure more effectively. They discover things that their predecessors didn't. On the other, the clinical gaze changes the status of the patient. The person becomes a case, and the complaint becomes a symptom waiting for localization.
Think about the everyday consequences of this. How many of us or people we know have left a doctor's office feeling dismissed because a clinic's measures could not locate the source of suffering? Or how many of us have had to go to 5 or 6 doctors before one of them was willing to take us seriously, only because the previous ones couldn't actually see where the problem was? Symptoms that are real may have no clear lesion to attach to, and in many clinical cultures, absence of a visible lesion can be interpreted as absence of disease. And that's not just an epistemic slip, it's a moral one. It shapes who is heard and who is not. This knowledge gap becomes a power gap. Doctors, by virtue of specialized sight and vocabulary, occupy a place of authority. With that structural asymmetry, the fact that knowledge is not evenly distributed, belittlement, neglect, and paternalism become possible. It's a risk baked into the epistemic form itself. And look, most doctors are not going to act this way. They're going to take pride in actually caring about their patients as human beings. And full disclosure, every single doctor I've had has been wonderful. They've treated me with respect, with care, and actually listened when I had something to say. But there's another place where this clinical gaze functions beyond the bedside, in how we see one another. When we learn to look at bodies as collections of risks and metrics, that habit doesn't stop at the hospital door. Public health messaging, diet culture, fitness trackers, and social media all encourage us to evaluate bodies by a clinical metric. The effect is subtle. We begin to judge people as bodies first and persons second. It's no accident that stigma attaches to visible signs, weight, scars, aging. When health becomes a metric and metrics are moralized, the clinical way of knowing leaks into the social domain. What was once a diagnostic category becomes a moral verdict.
And look, before Dr. Mike comes screaming at me, none of this is a case against modern medicine. I'm not saying that we need to rebuke all modern doctors and run out to the stores to buy every GOOP product off the shelves. I genuinely believe that we are far healthier than our ancestors ever were, and not just because of longer lifespans. We have anesthesia, antibiotics, sterile operating environments. These are tremendous achievements that help us to cure way more effectively than they ever could have. But our responsibility is to name both truths, that modern medicine has incomparable achievements, but that the ways that made those achievements possible can also leave us with blind spots.
If medicine is partly an epistemology, then it's also contestable. What we teach, what instruments we prioritize, what counts as evidence, these are choices. They were choices when Galen's authority dominated Europe, and they are choices today as corporations consolidate medical services, as algorithms shape diagnostics, as global health systems centralize care, and as people like him try to tell us what medicines we should or shouldn't take. Medicine cured more than we could have imagined, but the ability to cure rests on ways of seeing, ways that are taught, defended, and sometimes exclusionary.
The lesson of a longer history is not to romanticize a past that lacked antibiotics. It's not to run off to the stores and buy up every GOOP product off the shelves because that's how we're going to get healthy again. It's to remember that our present was made by choices, by teachers and tools, and if we accept that, then the question is no longer simply, are we healthier, but how do we see, and what do we risk when our seeing goes unquestioned? History doesn't undo progress, it complicates it, and in that complication lies a better medicine, one that heals bodies and keeps human beings visible.